can no longer separate global health from America's health. In total, more than 1 million people drive across our borders, dock in our ports, or land in our airports every day, and any one of them could bring a new virus or bug with them. In a world where the flow of people and goods stretches across the globe, our only chance to keep Americans safe is if the systems for preventing, detecting, and containing disease stretch across the globe also.
That's what a group of researchers are working on with their new blood analysis chip. With one drop of blood, it can detect HIV, malaria, tuberculosis, and even some cancers, all at the same time and even faster than ever before.
Just HIV, I think there's around, a little bit less than 40 million people infected in the world. In the case of malaria, about 500,000 infections per year. The problem worldwide is huge, and this is just 2 infectious diseases, and there's many more that could be helped. If you really want to have a realistic chance of tackling those kinds of problems, where you want to be screening millions of people over short periods of time, with a limited budget, limited resources, probably with existing techniques it's probably impossible to cover that because of just the sheer cost of being able to do such a large-scale operation. With miniaturization, I think that you could bring that cost down to a few cents per test. You can speed it up to a couple of minutes per test. If you look back in the telecommunications field, if you look back in the computer field, miniaturization has really revolutionized the way we operate, the way we do business. Then I thought, well, wait a second, could we apply this also to medicine and healthcare? That's where I started working in microfluidics. And microfluidics is basically the use of tools that have been developed over the last 50 years for integrated circuits. But instead of making actual electrical components, now we can make little plumbing, little tubes and little chambers, and we can put them together and synchronize them in such a way that they can perform many steps that you would normally do in the large scale, but you would do in a lab. You can almost see how the cells just fall into the bottom, almost like a waterfall of cells, of blood cells. And on the upper side, this clear side here, you actually have a very clean plasma. The actual polymer that makes up this entire microchannel structure system is sucking the air out of these microchannels so that the flow can start to happen. Proteins that are floating around in the blood plasma will be captured onto the surface of these microchannels and then taken downstream into the biomarker detection area. And if there's any signals, any chemical signals in the body related to disease or some other condition, they get transported in the blood. That's the beauty of miniaturization, that you can now put together many different chemistries that capture many different kinds of antibodies or proteins. And what that allows you to do is go through a checklist and see, okay, does this individual have, for example, HIV? Does he have malaria? Does he have hepatitis? Does he have diabetes? What kind of diabetes? And the list can go on and on and on. And you can envision basically a system where, in one shot, you analyze everything, and all at the same cost because it's all on the same chip, and it's all miniaturized. It's all accessible. It's useful to really diagnose type 1 versus type 2 diabetes because the way you treat both cases is profoundly different. In one case, you might need to go directly to the intensive care unit, and in the other case, you just have to learn about a good diet. So right now, for the blood tests to be done, a sample is taken and then it's shipped off to a lab, and it takes about a week for that to come in, and that's a week lost of treatment, especially in the severe case. Sometimes I guess you might not be expecting certain diseases. You might have certain symptoms and you might think, okay, maybe it's a flu, but instead it was HIV. But now if you had a device that can diagnose that one thing you think it was, but at the same time, just in case, figure out whether it's a whole bunch of other stuff, then that can have a profound effect on the way you treat diseases. I think that this is probably one of the few ways of doing it. I can't think of any other way of doing it.
As Secretary Clinton has said, at a time when people are raising questions about America's role in the world, our leadership in global health reminds them of who we are and what we do.